You've argued, and this is a quote, healthcare costs are damaging the total economy and destroying government budgets. How far off are we in the United States from getting it right and getting it to a place where we're not risking, really our economy?
Well, we need to stop the increase in healthcare costs because it will destroy the economy. It will destroy government budget. Right now, state after state, they're cutting back on schools, they're cutting back on educational budgets, they're cutting back on streets and roads and bridges just to pay for health care. That's crazy. We're spending $2.8 trillion on health care in the U.S. And we should freeze that, and that's enough money.
But it's interesting, just in the last, I'd say 9 months, I've seen my costs, just one example, go up.
Yes.
Whether it's visits to the doctor. So a typical American feeling that and hearing what you're saying doesn't understand the divide. Is saying, I feel like I'm paying more. What's happening? How is this bringing
Americans
costs
are
down?
Well, right now, Americans are paying more. We haven't kicked in the safety aspects of the bill yet. We haven't done what we need to do to focus on patients with chronic conditions. We haven't done what we need to do to connect caregivers. When you take caregivers who have multiple health conditions, that's 75% of the healthcare costs in the country. And we should be able to reduce the cost by at least 10% for those people by coordinating the care, having the doctors work together, preventing the complications, preventing the kidney failures and the blindness. Most kidney failures can be prevented. Most asthma attacks can be prevented. But the way we pay for asthma care right now is just totally by the piece. It's not by the package. So the emergency room makes a huge amount of money when someone has an asthma attack, and the emergency room is totally isolated. If we had total asthma care purchased as a package, we could intervene. We could cut the number of asthma attacks. We could have the emergency room working with the primary care doctor to prevent second attacks. Care could get better and cost less.
But that's one thing that I find interesting because healthcare in this country is in so many ways a for-profit industry. Your company is nonprofit with nearly 9 million members. I'm wondering if a for-profit healthcare company can work the same way. Here's an example. I read that at Kaiser, a lot of your dentists coat children's teeth to prevent them from getting cavities later in life. A for-profit healthcare company or dentist could look at those cavities as a source of future revenue.
Right, but a for-profit company that is paid a fixed amount of money to take care of a population, if dental care was part of their expense level, they would coat teeth. The mistake is that we're not buying care by the package from the for-profit company. And a for-profit company that sells an entire package of dental care can also coat teeth. It's when you sell it by the piece and you add up the pieces and then add on an administrative expense that the system doesn't work. We've got to get away from piecework purchase of care.
But if a for-profit healthcare company is paid per package, then how do they meet Wall Street's expectations, the publicly traded ones, of increasing profit and revenue quarter by quarter? Do they do that just by population growth?
Well, if they're
or
prepaid,
do they have to get away from that?
If they're prepaid as a package for dental care, for example, if they cut the number of cavities, they actually will make more profits.
They're not having to treat that.
Yeah, the profits go up. But the secret is to buy care by the package. And the mistake we make is a piecework model of care. We buy every single piece of care by the piece, and no one can re-engineer pieces. So all of the re-engineering that makes cell phones cheaper and makes every other thing cheaper in the economy doesn't work in healthcare because we buy care by the piece. If we bought cell phones entirely by the piece, and you bought the keyboard from somebody and you bought the screen from somebody else, and everybody had their piece, the cell phone would never get cheaper. But you buy it as a package. If we bought asthma care as a package, if we bought dental care as a package, then you can re-engineer care, you can do preventive care, you can assign people to different jobs in care, and you can bring down the cost of care, and they can still make a profit.
You foresee that happening in say, the next 5 years?
I think we have to.
But do you think it
yes.
will?
Yes, I think it will. And the reason I think it will is because we cannot afford Medicare and Medicaid the way we're doing it now.